If you have been told you might need back surgery, or if you are considering it, this is the most important information you should read before making that decision. The assumption that brings most people to a surgical consultation is that surgery is the definitive solution, the thing that finally resolves the problem completely, and that physiotherapy is a gentler but less effective alternative for those wanting to avoid the operating table. The clinical evidence contradicts that assumption clearly, and you deserve to understand what it actually says. For disc herniation with sciatica, the condition where pain, numbness, and tingling radiates from the lower back down the leg because extruded disc material is compressing a nerve root. Multiple large randomized controlled trials have compared surgical discectomy against conservative management, including physiotherapy. The consistent finding across these trials: surgery produces faster early pain relief in the first 3 to 6 months for some patients, but at 12 months and at 2 years, there is no statistically significant difference in outcomes between the surgical and non-surgical groups. Pain levels, functional capacity, and return to work rates converge by the 12-month mark. For the patients who had surgery, that convergence came at the cost of an operation, a general anesthetic, 4 to 6 weeks of post-operative activity restriction, and the ongoing risk of surgical complications. For the patients who had physiotherapy, the convergence came from the body's own biological resolution process. Herniated disc material dehydrates and resorbs over time through the body's normal inflammatory and immune mechanisms, supported by physiotherapy that manage symptoms during the recovery window and address the movement factors that contributed to the herniation. MRI studies tracking patients with confirmed disc herniations without surgery regularly show significant or complete resorption of the herniated material at 6 to 12 months. And counterintuitively, larger herniations tend to resorb more completely than small ones because they provoke a stronger immune response. What this means in practice: a dramatic-looking MRI with a large herniation is not automatically a surgical emergency. It may represent a presentation with the best prospects for complete conservative resolution, provided the neurological red flags that change the clinical picture are absent. For chronic lower back pain, present for more than 3 months, the evidence for surgery as a first-line treatment is even less favorable. For the majority of patients in this category, those without progressive neurological deficit and without a clearly structural lesion requiring decompression, a genuinely rigorous active rehabilitation program produces outcomes equivalent to or better than surgical intervention in the peer-reviewed literature. Multiple systematic reviews have found that for non-specific chronic lower back pain, surgical intervention does not produce meaningfully better long-term outcomes than rigorous conservative management. For spinal stenosis causing leg cramping and pain with walking, decompressive surgery is clearly effective for severe cases with measurable neurological compromise. For mild to moderate stenosis without significant neurological deficit, physiotherapy produces outcomes comparable to surgical decompression for a substantial proportion of patients in the published evidence. Now, for the cases where surgery is genuinely the right choice, surgery is clearly and urgently indicated for progressive neurological deficit, worsening leg weakness that is measurable and advancing week by week, foot drop affecting your ability to lift the foot during walking, or any loss of bladder or bowel function. These indicate nerve compression causing irreversible damage if not promptly decompressed, and in these cases, physiotherapy is not the appropriate primary treatment. Surgery is also appropriate when a genuinely rigorous course of conservative treatment has produced no meaningful clinical improvement after 3 to 6 months. The critical phrase is genuinely rigorous. An active, progressive, exercise-based rehabilitation program attended consistently, with the home program completed daily and supervised by a physiotherapist trained in spinal rehabilitation. Not passive treatment alone, not a few sessions of heat and ultrasound. Most people who are told surgery may be necessary have not yet completed a genuine course of conservative management that meets this standard. The link in the description provides a complete evidence-based breakdown of back pain treatment options in Malaysia, including what a comprehensive physiotherapy program involves and how it compares to surgical intervention for each major condition type. Read it before your next consultation.